Do you need to enroll in Medicare Part D? In today's video, we're going to answer this question. So let's get right into it. So of course, with the original Medicare, you have your Part A, which is your hospital coverage, your Part B, which is your medical coverage. And if you need prescription drug coverage, you also need to enroll in Medicare Part D. That's what helps with your medication costs. So do you need to enroll in Medicare Part D, especially if you're not taking any medications? So let's start with this. You do not need to enroll in Medicare Part D if you have one of the three followings. If you have VA coverage, Tricare for life, or if you have credible coverage through your employer, 20 or more employees. So that would be a employer group coverage. If you have any one of these, you do not need to enroll in Medicare Part D. Now let's answer the question, do I need to enroll in Medicare Part D if I'm not taking any medications, I don't have VA, I don't have Tricare for life, and I'm not under a group plan? The answer is yes, you absolutely need to enroll in Medicare Part D even if you're not taking any medications. So why is that? You're not taking any medications. Why do I need a drug plan? Because once you are taking medications and you go ahead and enroll in Medicare Part D and you did not enroll when you was first eligible to do so, you will be penalized, unfortunately. And unfortunately, this is a lifetime penalty, okay? And we're going to give you an example of how much a penalty can cost you, but we want you to avoid the penalty altogether. So please, you do need to enroll in Medicare Part D. Now, if you have found yourself in a situation, you're watching this video and you're like, oh my goodness, I did not enroll in Medicare Part D. There are several reasons where you can get your Part D late penalty waived, and these are the reasons. Number one, you have to show proof that you had credible health insurance coverage, right? So that's obvious. You show proof, then the fee would be waived. Another reason you can get your Part D late penalty waived is if you actually qualify for extra help. So if you get approved for extra help, which is help that helps individuals lower the cost of their medications, then they will waive that penalty, okay? So how do you apply for extra help? You could go to SSA.GOV, look at the qualifications, and if you meet the qualifications, go ahead and apply. The application is literally less than 10 minutes. Another way you can get your Part D late penalty waived is if you are on Medicaid. So if you get approved for Medicaid, then they will also waive the Part D late penalty. Another reason you can get the late Part D penalty waived is if you lived outside of the U.S. So say you lived here in the U.S., you was on Medicare, and you moved outside of the U.S., say you lived in Colombia or whatever, and you went ahead and you delayed your Medicare because you're not here in the U.S., you come back to the U.S., then you could go ahead and explain to them that you was not on Medicare because you was living outside of the U.S. Of course, you have to show proof, your documentation and such to get this waived. Did you know that you can get a Part D plan for less than $20 per month? So it's best to go ahead and enroll in a low-cost Part D plan instead of paying a lifelong penalty. So now we're going to go ahead and do a calculation on what a Part D penalty could look like. Say you didn't have coverage for 3 years, okay? So let's get right to the screen and I'm going to show you guys an example of how this all works. So here's a calculation of a Part D penalty, and we're going to do an example for 3 years without drug coverage. The penalty works like this. So it is 1% for every month you did not enroll in a drug plan. And this 1% is based on the national premium on a Part D plan. So let's say the national premium is $35 per month. So 1% of $35 equals to 35 cents. So we're going to time 0.35 times the months that you went without Part D, which is 36 months. So that will equal to $12.60. plus whatever your Part D plan is. So that is an example of a penalty of not having Part D coverage for 3 years. We can help you do this calculation if you need any help. So yeah, that's it. So it's basically a lot easier to just go ahead and enroll in a Medicare Part D plan instead of having that penalty attached to you for the remaining of your life. The penalty does not go away. Anyways, thank you guys so much for watching this video. I hope I made it crispy clear on how it works when it comes to the Part D penalty and should you actually enroll in Medicare Part D. And the answer to that is yes. So anyways, if you have any questions, leave your questions in the comment section below. If you know anyone that need this information, please share this video. Like this video, give it a big thumbs up, and I'll see you on the next video. And don't forget, if you need any help, give our office a call. We'd be more than happy to assist. Bye.